Anterior pelvic tilt. What is it? Is it bad? Is it good? How does it affect movement? How does it affect posture? A lot of these questions come into play when discussing an anterior pelvic tilt. And whether you're in the movement world as a physical therapist, a personal trainer, or you're just someone looking to learn more, you've probably heard of this anterior pelvic tilt phenomenon. So my hope for this video is that we can simplify the process and give you a step-by-step guide to fixing an anterior pelvic tilt if it's actually causing you problems and/or pain. So with that said, let's jump right into it. Before we can understand the how, we need to learn why, but even before that, we need to understand two key terms: anterior pelvic tilt and anterior orientation. So an anterior pelvic tilt is good, it's normal, it's required for normal walking and movement and everything that we do. And when it's good, it's because we have relative motion available. Don't get too caught up in that. Think of it as just having the full normal capacity available. What relative motion means is simply that one joint has the ability to move opposite from the adjacent joints. So when we anteriorly pelvic tilt correctly, we see the sacrum nutate forward as the innominate bones move into extension, adduction, and internal rotation. Don't get too caught up in that if you're not in the movement world. What I want you to understand is that usually an anterior pelvic tilt will eventually turn into an anterior orientation. That is when the whole pelvis moves as one unit forward. And we can essentially start moving more forwards and forwards until we're so far out of the base of support that we have to compensate. And compensation usually leads to pain. So I want you to keep that in mind as we move forward, that there's a difference between an anterior pelvic tilt and an anterior orientation. Step number one, mindset. Before we can talk about how to address this, I do want to remind you that not all anterior pelvic tilts are bad. Like I said, we need them for normal movement to occur. When it starts to become a problem, that's when it's a problem. An anterior pelvic tilt can start to lead to an anterior orientation, just like I previously said. So if you're currently dealing with pain regarding an anterior pelvic tilt posture, just know that it's probably more of an anterior orientation issue. So when it comes to fixing it, we need to change the anterior orientation. We don't necessarily want to remove all anterior pelvic tilts, or I should say, remove the ability to find and get in and out of an anterior pelvic tilt. So I wanted to make that step number one in our guide because we do need to have that mindset as we continue moving forward. Step number two, awareness. This is by far the most commonly missed step. We can't change something unless we're first aware of it. So we need to increase our awareness of how to actually move our pelvis and increase our awareness as to where is our starting point. Where are we? Are we oriented? Are we anterior pelvically tilt biased but not stuck? So we need to understand where is our norm. And this is something I like to do with patients because it's super simple, but it's really effective. So we first want to understand how to move the pelvis, and how we do that is the following. So we're gonna start in a hook-lying position, and remember, we're just trying to increase awareness on how to move and control the pelvis. So instead of thinking pelvis, I want you to think of belt buckle. And if you had a huge belt buckle that would be pointed right here, I want you to first move your belt buckle towards your chin. That would be this motion. Then I want you to move your belt buckle towards your feet. That would be this motion. And so belt buckle towards the chin is a posterior pelvic tilt, and the belt buckle towards the feet is an anterior pelvic tilt. So someone that is stuck here is going to be more anteriorly positioned, have a bigger gap in that lumbar spine, and so we just want to learn, how do we actually start to control the pelvis? What usually happens as a primary compensation is people that struggle to posteriorly tilt the pelvis just force the ribs down. We don't want that. We can flatten the spine straight to the ground without actually spinning the pelvis. So if it helps, put your hands right on the hip bone here, the prominence here, and you want to feel a counterclockwise spin so your belt buckle goes towards your chin. Once we are aware of how to do this and we feel confident with it, then we can move to our next step. Step number 3, reposition. Now that we have the awareness on how to move the pelvis in the way that we want it to move, we need to now reposition the rib cage over the pelvis. When we're stuck in an anterior orientation, the pelvis is forwards, the rib cage is forwards, but they have this disconnect. We want them to better align here because it's going to give us a better starting position to not compensate and also to start to give the right muscles the leverage they need. So all we're going to do with this is we're going to put our hands right on the rib cage. We're going to slowly move our belt buckle towards our chin, and as we do that, eventually we should start to feel the rib cage come down. Now remember, this is because the pelvis is spinning counterclockwise, and that motion brings the ribs down, not just forcing the ribs down. So we're going to start to sync up the rib cage and the pelvis. If you're having a hard time doing this or achieving this, go ahead, bring your arms up, add a gentle reach as you do your belt buckle towards the chin. This gentle reach is going to depress the ribs, but again, we're doing it in sync with the pelvis, and we're finding and feeling that point in time where the rib cage comes down into a better position compared to being flared up like this. Step number 4, breathing. Now that we have the awareness to move the pelvis and we have a better position with the rib cage stacked over the pelvis, now we need to start to relearn proper breathing mechanics. When someone's stuck in an anterior orientation, we're going to see a lot of belly breathing, and that is a consequence of too much compression at the chest. Think of your chest and your upper back getting smushed together. Because they're smushed together, the air is going to go below at the belly, and we're not going to be able to get that full lung expansion to actually expand our chest and keep the chest and the upper back in more of an open state compared to this more compressed state. So what we want to do is we need to go through those first 2 steps. We need the awareness, we need the position to hold on to that, and now we need to move through very specific breathing strategies. In general, for these types of people, we want to think of blowing candles out, especially candles that don't blow out like trick ones. What does this do? If you go to blow a candle out, you're going to bring the mouth closer together, which is going to increase the resistance to give us more rib cage movement. That's the key here, because so many people that live in this anterior orientation have a rib cage that doesn't move. Conversely, if we went to more of like a fogging the glass type of breath, imagine you had to fog glass, you would open your mouth. That would decrease resistance. We would get less rib cage movement. That's not a bad breath, but for our goal, it doesn't align. So what we're thinking, we're going to our belt buckle towards our chin until the rib cage comes down, bring the arms up if we need to. And then once you feel the rib cage come down, put your hands back on that rib cage. And then I want you to exhale like you're blowing candles out. That won't blow out until you feel the rib cage move. Don't get too caught up in it right now. I just want you to feel what it feels like to have the necessary pressure to get the rib cage moving. So if we put it together, it looks like this. Then the next key step is to hold the ribs where they are and take a gentle inhale through your nose. We don't want to feel the ribs come back up. We need to maintain them in a slightly more downward position, and then we inhale softly through our nose. We want to feel and see this chest rise, and then we continue this sequence. Blow the candles out, feel the ribs go down, inhale without a ton of rib motion, and start to expand the chest. Again, this is all for the goal of increasing expansion of the chest, the upper back, and to start to retrain breathing mechanics. Once you have the awareness and the position and the breathing, now we need to put it into use. We need to start challenging this new position and breathing through exercise. I find that isometric exercises work really well because yes, we are increasing strength, but because we're not moving, we take that movement component out, we can still focus on our overall position. I find that when you add too much motion and things start burning, the motion plus the burn usually leads to us forgetting about the position. So isometric drills are great. Now, what's the overall goal? Well, we want to start specifically and strategically going after certain muscles. If we think about an anterior pelvic tilt or orientation, it's this type of posture. And what tends to happen are that the abs tend to get really elongated and weak, the glutes become elongated, and the hamstrings become elongated. So what we're going to do is we're going to put ourselves in a better position and then start to retrain these muscles how to work, and we need to be able to breathe while doing it. That's the key. If we do this without breathing, if we're holding our breath, we're going to relearn and really strengthen our orientation patterns. Things are going to start to compress and get stiffer. So we are thinking isometric exercises for a very specific way and a specific outcome that we can breathe in. Here are 3 examples. These are by far not the only examples. I just want to show you 3 examples that will start to target the abs in a very specific way, the hamstrings in a very specific way, and the glutes in a very specific way. The first exercise is a foam roller plank. I like a plank on a foam roller specifically when we are trying to change position because of the shape. The shape, or the cylindrical aspect of the foam roller, makes it really easy to move the pelvis in the right way. So it's a great way to really bulletproof our plank. And it's actually pretty easy once you go through it, but it burns. So all we're thinking is that when we go through this, we're putting the foam roller on the mid thigh, and then we're going head down. That way our neck isn't stuck in extension and causing and promoting, I should say, our overall extension pattern. So we'll go head down. We go chest up. That's getting out of our extension pattern. We're going belly button up. That's getting out of our extension pattern. And notice right now my belt buckle is towards my chin. We're in a great position now. All we're gonna do is start to breathe. So you should feel your abs at this point. So how are we breathing? The same way that we already talked about. So head down, chest up, abs start shaking a little bit. Inhale through the nose. Exhale like you're blowing candles out until you feel your rib cage move, right? And that's the sequence we follow. Now remember, this is a breathing exercise that burns your abs. That's at least what I like to tell people because I want them to focus on the breathing. Yes, you feel your abs if you do it right. So again, a very specific way that we are changing the position of the body to recruit the abs, to get them working, but also breathing during the movement. The next exercise is a foam roller isometric hamstring curl. This is great because we can really focus on the position while strengthening muscles that need to hold us there. The hamstrings are crucial to hold the pelvis in more of a posterior bias compared to this anterior one. So what you're gonna do is you're gonna go down, throw your heels on top of the foam roller. Notice how I said heels. I do want you to make sure that you take note of that because if you start on the toes, you're gonna get jammed up as we go through the movement. So we go with our heels. You can put something between the knees if the patient tends to be more collapsed or out. We just want knees at hip width. Then we're going to move our belt buckle towards our chin and think about peeling off of the ground. We're going to slowly lift the hips up. When we lift, we need to make sure we maintain this slouched shape. We don't want to start arching, right? From here, pull the foam roller back till you're at your midfoot. Check this. Make sure you're a little bit more tucked. I even just went into a little bit of extension. And then arms up if we need the ribs down. And then we're just breathing. Again, breathing the same way that we've gone through. And as we work through this, we're feeling the hamstrings as they are maintaining the pelvis in a better position. Again, this is how we start to target muscles to change the pattern. The last exercise is a heels elevated goblet squat. There's a couple of things to consider as to why I'm choosing this. The slant board in a heels elevated position is going to create a slight posterior center of mass bias. This happens because the slant board naturally pushes you forwards, and as a result, we tend to have a little bit of a posterior change of direction at the pelvis. Additionally, I'm choosing a goblet squat compared to a barbell back squat or a back load squat because once we go into this position, it's going to, again, allow us to have more of a center of mass shift back. So between the goblet squat and the heels elevation, we are putting our patient and/or yourself, if you're trying to do it yourself, in a much better position. Now, when we go through it, we're trying to be really conscious and make sure that as we go down, we're moving in the right direction. The right direction for this is vertical. We want to make sure we're not moving horizontally. And so what you may find over time is that as you move through this, you might need to stop a little bit higher and start to learn how to maintain the proper form. Over time, after you have enough work in conjunction with the other exercises, you should be able to get lower. Here's what I mean. So we go on it, make sure the whole foot is on, and then as we go down, I'm thinking about knees go forwards as I sit straight down. We have compression at the posterior pelvis, expansion at the front. That is the opposite as to what the typical pattern is. So I encourage you to go through this real slow, control, and make sure that you feel yourself going in that vertical motion, not letting yourself go horizontally. So those are the steps that I like to follow to really help move someone out of an anterior orientation and bring them back to having that relative motion of a normal anterior pelvic tilt without it causing problems. I want to remind you that, again, not all anterior pelvic tilts are bad. We need them, but if it becomes a problem, those are some of the steps that we really want to start to follow. Now, if you're looking to improve your knowledge on this, if you're a physical therapist or personal trainer, I would invite you to check out the free trial of the Clinical Coaching Specialist certification. I will leave all the information below. Additionally, if you're someone that's dealing with pain and you're in this anterior orientation and you want to learn how to get out of it, I will leave the link below to work with me virtually. How it works is we'll set up an assessment to understand where you are exactly at, and then we can provide the proper roadmap as to where we need to go. I will leave both those links in the description below. Thank you so much for watching. If you have any questions, let me know, and I'll see you guys on the next video.